This is a great quote that I use this a lot. Medicine is a science of uncertainty and the art of probability. It's more likely than not. How did you determine what you were doing for that particular patient, knowing what you should know, knowing what the postoperative or what the complications can be? The problem is that in a courtroom, the complication, whether it's known or not, they reframe it as a preventable error through the lens of a bad outcome, right? Because they know the outcome and they will look at that backwards. One of the things I always ask the surgery residents is that you're going to get a bad outcome, right? I mean, if I do 100 colectomies, left colons, 7 to 12% of that time it's going to leak. I'm rarely critical of the complication. It's not the complication that gets people in trouble. That is a known complication, well documented in the literature. It's the failure to recognize the complication